we are going to talk about work package 1. So we're now going into some of the detail of actually what we're going to be doing in our project. So, so this work package is all about psychosocial resilient recovery. So psychosocial aspects of creating resilient recovery in post-disaster contexts. So this, I feel like you've already heard a lot about this particular context, and to summarize with probably some numbers not exactly the same across our talks, but the 2018 earthquake, tsunami and landslides in Palu, central Sulawesi, Indonesia, killed over 4,000 people and damaged and displaced 164,000 people. And 12,000 schools were damaged or destroyed, affecting the education of some 184,000 children. And this project seeks to address the psychosocial consequences not only of the trauma of these events, but of being marginalized from decision making. So we're going in on 3 areas that are poor, where the people are poor and marginalized, and many have lost their livelihoods due to them being fishing communities before, and the boats are still actually have not been fixed, and so people do not have their livelihoods. So what does the community need in order to become more resilient? Well, both preparedness and recovery require that communities have some sense of control over their environments. And this is what we found in the 2 previous large studies that Tiziana, Rosetta, and I have conducted, that where we went into various cultural contexts, we found that control was a central aspect in people being able to prepare for their futures. For the marginalized groups affected, poverty and sociocultural beliefs can undermine the sense of agency, the sense of being able to bring control over your environment. And we take as our starting point the set of mechanisms favored by survivors from 8 other disaster contexts in order to build their resilience. And the most desired aspect in these 8 contexts are psychosocial support. So what we'll hear about more today is actually this has not been built into the models and into the thinking enough, the trauma and the psychosocial support that could follow from that. The other features of what people on the ground in 8 disaster regions want is they want community empowerment and cohesion, they want government collaboration, and they want the root causes of their vulnerability to be addressed. So quite a challenge. So for our particular package, the challenge we seek to address is, once traumatized, how can these communities recover resiliently so that they are prepared for the next disaster? And this is important not only because the survivors live in a region high in natural disasters, but also because climate change makes natural hazards increasingly likely, indeed, for all of us. So a wider and wider swathe of the world needs the tools to recover resiliently and prepare for the next disaster. We hope to be developing such tools in this study. I now want to hand over to Okta, who will now control the slides and give you more detail of work package 1 activities. Over to you, Okta.
Okay, Assalamualaikum warahmatullahi wabarakatuh. Good afternoon, good evening, and good morning, distinguished guests, honored ladies and gentlemen. So I will continue what has been explained by Professor Helen on work package 1, which is psychosocial resilience recovery. As we know, soon after the tsunami 2018, studies showed that half of households have at least one member of a family who is experiencing emotional disasters, including nightmares, sleep, and anxiety disorders, stress, and etc. And according to psychological assessment conducted by Indonesian Red Cross in 2020, it was found that people experience psychological conditions that require attention, such as changes in extreme behavior in adolescents and substance abuse, psychological reactions, which are symptoms of trauma, such as nightmares and excessive fear, and also children become addicted to playing games or gadgets. The COVID-19 pandemic has also made people lose their jobs and worsened the suffering of women survivors. In addition, the resettlement also creates conflicts with indigenous people in new areas. Moreover, based on the research result, students are still in displacement camps, many of them experiencing fear of being separated, fear for safety, and lack of sleep or irregular sleep. There are several psychosocial interventions which have been implemented by government, non-government, GSO, Red Cross, and other organizations. And also in 2019, Palu government has established the Regional Secretariat of Disaster Safe Education Unit. Beyond their capacity as educational institutions, schools can act as community center, which provide communities with a physical and social space to connect and interact with each other, thus providing informal social support and building a sense of togetherness. That's why in our research, we propose that schools become hubs for resilience building. So currently, there are many guidelines outlining how school can play as a part in the process of resilience recovery. And we have conduct a review, the key disaster risk management framework used for protecting children's well-being in disaster contexts, and identify a lack of considerations for psychosocial and water, sanitation, and hygiene needs. That's why we propose an adaptations of the common framework for a comprehensive safe school program, which is also implemented in schools across Indonesia. And we suggest the revisions to add a fourth pillar that address the psychosocial needs of students, children, and communities, and to reintegrate WASH into pillar 1. Next, please. I couldn't. Okay. Sorry. Okay, this project will focus on developing an intervention that will empower communities in Palu to reflect on their needs considering hazard resilient futures. The strategy of the project is to assess and then co-develop interventions for fostering resilience through schools with local stakeholders and communities. There are several tasks which will be carried out in this project, which includes the grid elaborations method, and then school community collaborations, innovative school-based materials, psychosocial support and education, psychosocial care system, and ecological communications linked to past disasters. This research will be conducted at 3 sites in Palu and Donggala that were badly affected by a combinations of hazard, including Sigi, which is affected by earthquake and trigger liquefaction, and then Loli Tasiburi, which is affected by earthquake and tsunami, and the last one in Mamboro, which is affected by earthquake and ground subsidence and tsunami. The research participants, including children aged 11 to 14 years old, and their caregivers, and then teachers and community. We will conduct several methods to collect the data, including in-depth interviews, focus group discussions, workshops, and survey. So that's all my presentations on the work package